We're going to talk about the different approaches to managing patients with cervical spondylotic myelopathy. This presentation is brought to you by the Brain and Spine Surgery Consortium here in Abuja. Now, when we talk about cervical spondylotic myelopathy, we're talking about people with arthritis in the neck that is actually pressing on their spinal cord. So when they come into hospital, they complain about neck pain, arm pain, numbness, weakness. Some talk about pins and needle sensations. Some also talk or describe this shock-like sensation that go down the body. A few people describe difficulty in walking. Some could also be so bad that they have problems with their bladder and bowel. Okay, so when we examine them, we're looking for weakness of the arms and legs, numbness in the arms and legs. We're looking for jumping nerves, where when you check their reflexes, it is exaggerated. Also, we can see evidence of disability, and we can measure this with so many different scales. The key investigation, of course, is an MRI scan. And here we see an MRI scan of the neck of a patient. Looking at this cord, this is a normal MRI scan, and this is the way MRI scan should be for most people. When you look at the MRI scan of a patient with cervical spondylotic myelopathy, we now see that there is pressure on their spinal cord, as you see here on this particular MRI scan. The red arrows show where the pressure is on the spinal cord, and there is evidence of this white matter change, or this whitening inside the spinal cord, which signifies swelling and injury to the spinal cord. This other MRI scan is of another patient, and in this one we see that a lot of the pressure is coming from the back of the neck onto the spinal cord in 3 different areas. So there is pressure on the spinal cord, there is the same white matter changes on the spinal cord, and evidence of injury to the spinal cord at 3 different levels. Another MRI scan showing both spondylosis or significant arthritis in the neck of the patient, and we see the same damage to the spinal cord in this particular MRI scan. This final MRI scan shows that white matter change that I've been talking about, or that sign of injury inside the spinal cord. So, when we see a patient like this that have the symptoms, that have the signs, and then the MRI scan shows that there is significant damage ongoing to the spinal cord, if it is moderate and severe, as in the cases that I've shown you, then we will advise surgical intervention. The aim of surgery being essentially to remove the pressure on the spinal cord. We need to stop the deterioration and damage going on to the spinal cord. Hopefully, this will improve the condition of the patient so that they can regain their lives again. But what is important, of course, is that patient safety is paramount. We need to be able to assure the patients that we can give them a good outcome, which essentially means stopping the deterioration. When they improve, that is actually, a bonus. So the operation for cervical spondylotic myelopathy can be performed either from in front or from the back of the neck. What we choose depends on the direction of maximum pressure on the spinal cord. It also depends on the patient as to what kind of operation the patient can tolerate and what is best for the particular patient. Now, we'll talk about anterior neck surgery, which is operation from the front of the neck. And in this case, we see a patient who is in theater, has been positioned on the table, and the area of the neck has been exposed for the operation. You also see or notice the roll behind the neck to give some support to the neck when we're operating in theater. So here we have the patient positioned again, and this particular slide should show the kind of equipment that we require in theater. In this case, we need an image intensifier, which is an X-ray inside the theater to see exactly the level of the operation. This is very, very important, and this kind of operation should not be performed without this particular machine. Now, we're showing X-rays of the neck following the operation. In this case, we have done the operation at 2 levels in the neck and taken some bone from the hip to put in the area where we have now gone in from in front to remove the pressure of the spinal cord. In this second patient, we've done the same operation, but instead of taking bone from the hip, we've now taken an artificial material called a cage to put into the space where we've done the operation. This acts as a spacer, to keep the pressure off the spinal cord. In this final X-ray, as you can see, This is another patient. We have taken bone from the hip, but we've now gone further to put plates and screws to lock up that particular area after completing the operation. So that was talking about operation from the front of the neck. We can also do the same operation to remove pressure off the spinal cord from the back of the neck. This is called the posterior neck operation. In this case now we see another patient in theater who has been positioned, ready for surgery. This is another view of the same patient, and here you see the actual part of the neck with the hair shaved off a bit, and we have actually marked out exactly where we're doing the operation. One important thing about patient safety, of course, is preventing them from developing blood clots in the leg. So we use a TED stockings or this kind of calf compressor, which keeps pumping the blood back to the heart and so prevent blood clotting from the neck. This and other, protection, for the patient in theater is actually quite important. And here we've cleaned the patient, we've put sterile drips on, and we are ready, for the operation. And this is, us in theater doing the final check before the actual operation begins. And now the operation is in progress. We have been talking about cervical spondylotic myelopathy, how the patient presents, what symptoms they have, what we find on examination, and what we see on the MRI scan. We've also discussed, of course, the kind of operations that are possible. But the key thing is that we are operating to remove the pressure of on the spinal cord to improve the condition of the patient and stop the ongoing damage. For more information, you can call us on 081 2222 1616. You can also share this information, and there's more information available on our Facebook page.